There are several myths with rhinoplasty. The first one is the anesthesia dangerous? Well, 95% of my patients, we do it under oral and intravenous sedation, and it's very, very safe. People get minimal nausea and vomiting. You can also do it under general anesthesia. The anesthesia today with cardiac monitoring is very, very safe. Number two, can any surgeon do rhinoplasty? Well, as I mentioned, I have a 30-year history of doing rhinoplasties, trained at the American Academy of Facial Plastics, Otolaryngology, and the American Board of Cosmetic Surgery. So I have a lot of experience. In my history, we've invented with my partners 2 different surgical procedures for the nose to improve both function and aesthetic results. So it's good to have experience. Most people that are cosmetic or plastic surgeons will agree that the most complex cosmetic surgery is a rhinoplasty, especially a revision rhinoplasty. So yes, it's important to have someone with good experience and training to be the best rhinoplasty surgeon for you. Another myth, rhinoplasty is very painful. It's actually minimally uncomfortable. So during the procedure, we do nerve blocks, local anesthesia. So if you had it done under IV sedation, it's minimally uncomfortable during the procedure. Afterwards, most people only take pain medication, either Tylenol or an oral narcotic analgesic for 1 or 2 days, and that's all, okay? Another myth, all rhinoplasties give you a fake appearance. Well, that's very rare. The only patients I've noted, either that I performed or other patients, is other doctors on patients, is that they have a very ski slope look, a Goldman tip and more of a ski slope look, in my opinion, is a fake nose. So we, luckily, during my 30-year career, have not produced that type of fake appearance. You want it to be congruent with the rest of your face, harmonious. So that's why we look at the eyes, the nose, the mouth, and the skin. They make the biggest impact. So besides blepharoplasty, the rhinoplasty or nose job makes a significant impact on your appearance. Since your nose is right next to your mouth, doing lip filler or lip implants to make your lips full. Sometimes we do a lip lift at the same time, or doing something to your chin. People who have a retruded or small chin, if we put a extended anatomical implant when we do the rhinoplasty, they get a superior result. So the results are natural, okay? We design our surgical technique to get your individual result, what you're looking for, to get your ideal outcome. So do we use sometimes other technologies? Yes. Sometimes we use cartilage grafting from your septum or your ear. We can reduce the size of the turbinates using radiofrequency ablation to make your nasal breathing better. We can add a splint to your nose post-operatively for a short period of time to prevent you having any further bleeding or swelling to the dorsum. So all these things are designed to get you the best result. So the myths that people brought up, really none of those that I've mentioned are practical in today's rhinoplastic surgeon.